Our next speaker is Dr. Schrader Barilli. She received her medical degree from George August University in Germany, where she graduated cum laude. She had an internship at St. Vincent's Hospital in New York City. Her residency was at Temple University in Philadelphia, and she had a fellowship at Robert Wood Johnson Medical School. She's board certified in Otolaryngology and plastic surgery, and she's a member of the American Academy of Otolaryngology and Head and Neck Surgery, the American Academy of Facial, Plastic, and Reconstructive Surgery, the American Board of Facial, Plastic, and Reconstructive Surgery, and the American Board of Otolaryngology. Dr. Schrader Barilli has a practice in Princeton and is on staff at this hospital. Thank you.
I have a Mac, so I'm just trying to.
Yeah. Here on the right side.
So I try to use this microphone to see if that works a little better. So we'll talk a little about treatment of the aging Asian face. I'll go over some aging signs in the face. I focus on the Asian population. I review some cultural aspects that you're probably more familiar with than I am, and some patient motivation. Doing this talk, I realized how popular plastic surgery is in Korea. I had kind of an idea, but I didn't know to what extent actually how popular it is. And then we're reviewing some treatment options. So, K-pop stands for Korean pop, and the Gangnam style, what I learned is means wealth, style, culture. It actually has spread and sparked imitations over the border of Korea into bordering other Asian countries. And reviewing the literature, I saw that really a large number of high school students today's time get plastic surgery in Korea. Very popular is the double eyelid procedure. And there's, when you compare to other Asian countries, there's more plastic surgery in Korea and Vietnam than in China and Japan. And I saw this, I copied that ad out of, I guess it was on that street in Seoul. There's one street in the entertainment district that has actually 300 plastic surgery offices. I think Princeton has maybe 8, I don't know. Well, so just to get an idea, I was very impressed by this. And the Korean pop culture really influenced, today's time, influenced the selection and the spread of aesthetic surgery. And also what I learned, it's actually well accepted in Korea. People talk about it. Actually people are almost, proud, they talk, it's really well accepted, maybe more under the younger population, but this is what I came across. And a lot of young Asian emulate the look and appearance of famous Korean popular icons. I don't know who this gentleman is, but you may know him from some kind of a show or anything. And there is some cultural aspects that you're also probably a little bit more familiar with. But for us plastic surgeons, seeing a Korean patient, it's very important to incorporate these aspects on the initial consultation and treatment options. So a larger nose apparently means that there's a greater predilection for wealth and fortune. Larger ears are a sign of wisdom, and it has been really it's not a very common but a popular request, and on the Caucasian population, if the ears are large in a young child, and outstanding to correct this, but it's not so popular in Asia. Dimples increase one's marriage prospect and fertility. There are actually apparently clinics that are actually creating dimples to enhance some of the results. And on the other side, skin blemishes have a negative life force, and large nostrils seen from the front associated with risk of money floating away. So goals, these are not particular for Korean population or Asian population, it's also for my population. All my patients that I see, they want to improve the appearance, they want to turn back the clock, and they want to age more gracefully. I put a question mark in front of the westernizing. It's really, this is what I see, culture preservation is more popular than actually to change, especially in the Korean American population, so it's not. Facial aging in Asians. In general, Asians, facial aging is delayed. Compared to the Caucasian, it's about 1 or 2 decades later. And they explain it by the thicker dermis, thicker superficial layer of the skin, darker pigmentation, protects from photoaging, protects from the sun. So the skin has less wrinkles, there's less loss of gravity, less elastosis and aging change that cause jowls and neck laxity. So this is just delayed compared to the Caucasian population. This is actually a very important image, a split face on the right side, or on the patient's right side, a useful male Asian face. On the left side is the aging. Some of the aging facial features that you see, and if you notice, there's a lot of orbital hollowing. There's also, when you just look at the length of the lower eyelid, it's much lower than in an aging face, in a younger face. So they almost get a triangular shape lower eyelid. There's fat bulging, but there's hollowing underneath. And in general, volume loss in the cheek creates these deep smile lines called also nasolabial lines. And then sure, there's some hyperpigmentation that occurs over time. So patients that I see, most of the Asian patients that I encounter in my practice, they come first because they want to have larger, brighter eyes. They want to have a flawless skin without hyperpigmentation. They would like to have their nose augmented, and they want to have less prominent jaw and more of a reduction of the facial square appearance. So going more from squareness to a heart-shaped face. And sure, if there's a deficiency, chin augmentation and improvement of the jawline. Let's go over to the skin issues. It's very common complaint in the Asian population. Melasma is our brown patchy areas on the cheek, forehead, and nose. And it's associated with the overproduction of melanin by stimulation of estrogen and progesterone on melanin-producing cells. And so this is a common commonly in a female patient. It's also during hormone changes, birth control pill, menopause have effects, and also commonly with sun exposure. And especially in the Asian population, any kind of trauma, surgery, irritation, or acne can cause sort of something called post-inflammatory hyperpigmentation afterwards, and that's difficult to treat. And as you see on this, I just show the area of melasma that's commonly formed in the cheek area. Another is like more of a hyperpigmentation that occurs in the cheek. Treatment is not much different from a Caucasian patient. We use topical retinoids. They increase the cell turnover. We use hydroquinone, 2 to 4%. It's an agent that inhibits tyrosinase. It's an enzyme that actually stimulates melanin, so we kind of prevent stimulation of melanin production. Sunscreen is very important. I don't give my patient anything below 45. An IPL that I use is an intensive pulse light. It's fairly safe to use in the aging population to treat some of the hyperpigmentation in very light chemical peels. Got it. Laser treatments in Asian population is treated with caution. And like I mentioned, any kind of trauma to the skin can cause even more hyperpigmentation. So any kind of laser trauma can cause more hyperpigmentation. So a lot of lasers we're not able to use on a more darker pigmented skin. An IPL, which is the intense pulse light, can be used with a special wavelength selection in darker pigmented skin. I move on to the eye. It's a very popular topic. And who's a candidate for eyelid surgery? As patients who have upper eyelid hooding, they can be to the extent that they actually have visual impairment. Then also periorbital hollowing, as you probably remember from the picture or from the photo earlier, the periorbital hollowing can affect the signs of aging too. And fat protruding in the lower eyelid, which you can see here on the photo, which made the lower eyelid very low and sort of triangular shape. These are most commonly requested issues for surgery. So you know the Asian eyelid is very different from the Caucasian eyelid, and I'm not going into much of the detail, but there's no supratarsal crease and forming a single eyelid. And it's because there is a muscle called the levator muscle. It's not fixated to the skin, and so there's no crease formation. But as you see, it's a single eyelid is only in 50%. So 50% of Asian do have some sort of a crease. It can often be on an incomplete crease or a very low crease. This is kind of high, but usually it's a very low crease which leaves like about a couple of millimeters over the ciliary margin. So there's three categories. There's patients without a natural crease, there are patients with a natural crease, and since eyelid surgery is so popular in Korea, a lot of my patients that I see already had previously created a crease. So now they're seeking for treatment for aging. So, and just to show you what I mentioned, one lid and the same patient has asymmetry, has an incomplete crease, and this is a patient who already had surgery, young, and has a crease created. So our strategies are, so what do we do with patients now with who have no crease and seeking treatment for it? If we do treat the upper lid hooding, we kind of would like to create a little crease, a very low crease, a very natural looking crease. It does change a little bit the appearance, and that's a common concern, especially in my male patients. But without it, if we don't create a small crease and just take a little skin and fat out, it's often not enough of an improvement. This is a patient who had upper eyelid surgery, and you see very important is to maintain the Asian look and create a very small and very low crease. A patient had surgery done, creating a very low crease, not a high crease that you see in Caucasians. And just, I'm not showing any surgical pictures, this is just one from the surgeon's view, seeing that the lid, that the crease that's been created is very low, very close to the eyelash line, and fairly straight, compared to in Caucasian would be much higher and rounder. And so the muscle is fixated to the skin is closed and creating the crease. I move on to Asian rhinoplasty, sort of the third most common procedure in the Asian population. They, compared to the Caucasian, it's who like to mostly reduce the nose size, narrow the nose, change the nostril, lift up the tip. In Asian population, it's mostly augmentation of the nasal bridge as well as the nasal tip, and with the preservation of their own identity. So in Korea and China, it's very common to use a silicone implant. It's an in-office procedure. These implants are pre-formed, they are pre-shaped. They're sort of just slide underneath the skin to lift up the dorsal height and the tip height. In the US, no silicone implants are used. They were associated with some complication of extrusion and infection. We use, and I use, mostly cartilage grafts that's harvested from the septum or from the ear. And some of my colleagues even use rib cartilage to achieve the augmentation results and need more grafting material. So I also use fat. It's the own body fat if I have to do like minor augmentation, lifting of the nasal dorsum. Some of the pictures, you can just see just really minor results, just lifting up a little bit of the dorsum. Same thing, just lifting up the nasal tip and creating more of a softer appearance. And also filling an implant, sort of a cartilage grafting in here to just narrow the nose and lift up the nasal dorsum. So there are a lot of other surgeries to talk about, but other of the Asian face, we do perform facelift surgeries, chin augmentations, implants, and facial volume correction with orthodox fat. So who is a candidate? Everybody who has a little bit of skin laxity, so jowling, less like jaw definition. Also patients with volume loss, as you remember from the photo I showed earlier, in particular in the medial cheek, creating deep lines. Asian facelift is not much different from the Caucasian facelift. We use the same technique. Like as I mentioned, Asian age later, they also have less skin laxity, so it tends to cause less of extra skin. So we excise less skin. It's more of a repositioning of facial tissue than taking it away. And also of correction of smile lines and jawline definition. I just put this in there so you have an idea where like the regular incisions would be. They're around the ear. This is more of an intense surgery. It's more of an invasive facelift where you go further into the hairline of the temporal area and back of the ear. And that's more of like a minimal lift where you just really stay close to the ear just to lift up the jawline. Usually they always show a really young patient that doesn't need any surgery, but so. This is some of the patients that I wanted to show. Just this woman is before a facelift and rhinoplasty and sort of improvement of her jawline, tightening up her lower face and repositioning of some of the cheek tissue. It's really minor surgery. On her, it's really just treating like the jawline. Same on her, she had additionally also some rhinoplasty and eyelid surgery, but just improving some of the lower face jowling. So I want to mention one thing, because I showed you the Asian male face earlier with the volume depletion. Losing facial volume leads to a more tight and hollow look, and we try to target these areas with fat grafting. And any kind of area that are depressed and hollow can be sort of filled in with your own body material. It creates a more balance in the face. It transforms an aging face to a more useful, heart-shaped face. And you may wonder where we get the fat one. Actually, we harvest it wherever it's available. It could be the abdomen, inner thigh, outer thigh, buttock. And it's really, really a nice result, and I show you some photos to really get some volume back into the face. This is a more of a younger face, but she got some volume enhancement into the cheek area and softening of her lines. She also got a rhinoplasty. This is an aging face, and you see like hollowness around the lower eyelid, hollowness around the medial cheek, really got nicely improved just filling in this area, more of a softer look. And also she had a little bit fat injected into her nasal bridge, creating a more of a height. Younger face, she had really volume depletion in her lower lid, volume depletion in her medial cheek, deep nasolabial fold. This got all much softer, just injecting back some volume in and filling in the depressed areas. I just want to mention the next two slides only because I get a lot of requests and I see a lot of patients asking for jaw reduction. It's very common and very popular in Korea. The non-surgical method that I use, and some of my colleagues are using, is injecting Botox, which is a neurotoxin, into the masseter muscle. The masseter muscle sits in this area. It takes about 2 to 3 months for seeing any effects. They're temporary, they last about a year to 2, but as you see, it creates a thinner jawline, a more of an elongated face. In Korea, this is very common, and also in China, to do jaw reduction surgery. Basically, what they've been doing is they're shaving the inner portion of the jawbone down and really creating a very different look. And when I look back into the K-pop culture, I think this is sort of a look they present. This is a very uncommon procedure in the US. Additional risk, as I mentioned earlier, there's a risk of hyperpigmentation, any kind of trauma. You do in patients with thicker and hyperpigmented skin to begin with. There's also a risk of hypertrophic scarring and keloid formation, and these risks are higher compared to the Caucasian population. And this needs to be considered when you select a procedure or consider more of an invasive surgical procedure. Put them together. Treatment of the aging Asian face is unique and is a relatively new field. The techniques originating from the Western countries are developed for the Caucasian population, and the advanced plastic surgery developed for the Asian population focused on Asian eyelid surgery, nose surgery, and jaw definition procedures. And mentioned the skin hyperpigmentation. Any questions? Okay.
I was wondering, since we hadn't really planned this, but the two presentations kind of fit together.
Yeah.
And I was wondering if, I'm assuming a lot of people come actually in the middle of a midlife crisis,
Very common.
wanting facial surgery, and I was wondering if people have become more depressed afterwards because they're trying to find a solution to a problem which can't be treated by changing the face.
Yeah, it's actually very good that you mention it. It's actually very common after a major life change to seek plastic surgery or at least seek a consultation. I see a lot of aged women and men who lost a spouse, have other issues at home, and looking into a consultation. And that's just it's such a careful selection of your patient and time. So there might be patients that I say, come back in a year or two, and we'll revisit the whole consultation, and and they're often very happy. It's not that they're really upset and go to the next plastic surgeon, and often, sort of clarifying everything with them, what they really want to achieve and what are their problems, and not just deferring it to a later moment, but, open, discuss the issues and maybe just seek other help first before you continue. Because it's true, if they think plastic surgery will be a solution and it's not, it will be very depressing for them, so.
I have a question about you mentioned aging, delayed aging of Asian face. And you also mentioned it is possibly related to the amount of pigmentation, melanin. So if you compare the Asian to the blacks, are there much of difference? Or
There's a lot of similarity, also to the Hispanic population. Similar with the thicker dermis, thicker skin, hyperpigmentation is pretty much very similar to it. Also for the additional risk of keloid and hypertrophic scarring. And that's sort of, there are Asians who are very, very light, but still respond with could potentially respond with hypertrophic scarring. Like if there would be more of a pigmented, if they would have more pigmented skin. So that's just a thing to think about, that you would react like somebody was more pigmented, but even if you not pigmented. A lot of Asians protect their skin very well all their life, so they are fairly light, but could react the same way. That's true. And then same one is with the Mediterranean as well as the Hispanic population.
When is the best time to do any seasonal, winter, summer?
I prefer fall to spring, just to get away from the sun issue. But a lot of my patients go into Caribbean or Florida in the winter, so I'm facing the same thing. It's just really well, you just have to encourage the protection and really select the patient carefully, the one who follows the rules. But because of the migration and moving, it's really difficult to find the best. If somebody lives in New Jersey and doesn't travel, I probably will prefer from spring to, or from fall to spring, and not in the summer.
I have a question about the fat injection. Is that something permanent, or does it go away, or actually does it migrate?
Good question. Actually, all the studies have shown 40 to 60% what's left is permanent, sort of permanent, because you continue to lose volume. So in a few years later, you lose other volume, or you lose volume on the fat that was injected. So it's not really, but it's sort of considered being almost permanent if it lasts maybe 5 years, 7 years. But the initial absorption is around 50 or 40 to 60%. They've done MRI studies and shown in the first 3 to 6 months you lose some of the volume. Not each fat cells get revascularized, so they just get absorbed by your body. But the other option would be an alternative filler. I didn't mention anything about Botox and filler because it could be another different topic, but we have fillers that are temporary and 6 to 12 months. We have fillers that last up to 3 years. And Europe and other countries have more of permanent fillers, like some of similar to silicone material that are approved and being frequently used.
Yeah, what are the recovery period or these procedures, I guess?
Everybody's different.
Oh.
Everybody's different. Anything from days to a couple of weeks.
How about pain? Is it painful?
Pain depends also on what procedure. I think the first 24 hours is tough on anybody because even if you're not in pain, there's an anxiety level, there's things to take care of, and so the first 24 hours are a little tougher. But everybody's so different. If there are people who bruise and swell, and then there are people who don't bruise and swell and have much easier of recovery. And then there's people who rest, and then there are people who don't rest, and use the 1 week or 2 weeks they take off to clean out the entire house. So it's very common to use the time to be more active at home.
in rhinoplasty, I was always wondering, do you inject or do you put the incision line?
I do an incision line and basically look in, and unless it's an injection, like fat injection, we inject, we don't have to open, but if I use any cartilage grafting, it's done open. They are, in the US, it's probably by now 70 to 80% of the surgeon using an open approach and 20 to 25% using a closed approach. In Europe, it's vice versa. They're using a closed approach more frequently than an open approach. I use often an open approach to see where the cartilage is laid, secure the cartilage, so the results are really more controlled and
So does it leave any scar tissue?
it does have a little scar on the bottom, very low here on the, it's called the columellar. It's an incision line that's heals very well. And interesting, if people develop keloid or hypertrophic scarring, it's never in the mid-face. It's always around the ear on the side of the face. And that's with anything. It could be with skin cancer, it could be with any kind of procedure. Keloid formation, we see it off as piercing or surgery around the ear, but we never see it in the mid-face. So the incisions around the nose are healing really well.